All right. So now what we're going to discuss next is the concept of passive insufficiency. And active insufficiency, we can talk about it as well, but I want to sort of focus this next video on the passive insufficiency. So let me move it a little bit better so we can get a better view. Okay, there we are. Now, because the test question was on a quad muscle, we're going to go ahead and represent that, okay? Now, put Sam over here. And what we're going to do with Sam is we're going to give him a rectus femoris. So the rectus femoris for Sam is going to be the yellow T-band, okay? So, why don't you answer me? What's the origin and what is the insertion of the rectus femoris? While I prepare. Yeah? So if you said rectus femoris originates on the anterior inferior iliac spine, you're correct. And if you said that it inserts, better connection over there. If you said that it inserts in the tibiotuberosity via the quad tendon, then you are correct. It doesn't stop here. It crosses the knee and it goes to the tibiotuberosity. That is the insertion of the rectus femoris. Boom. Now, why did I choose, look at my rectus femoris. It looks so cute. Let me lower this just a little bit. Five. All right. Now, oh my goodness, we ripped the muscle. All right, so now we have it at pretty tight, okay? And we have a description or a visual of what this looks like. And why did I do the rectus and not the other quad muscles is because the other quad muscles do not cross the hip. They stop right here, right? The rectus is the one that's crossing way down here, as you can see, and then it's crossing way up here, as you can see as well. The concept of passive insufficiency simply means whatever position I put this two joint muscle, that it stretches it to its maximum, will not allow me to stretch anymore. Because if I do, I'll tear it. So let me give you an example. If I don't stretch this part, if I flex this part, I want you to look at how slack it looks. Because I flexed the one joint that it crosses up here. Then, if I wanted to stretch it out, do whatever, thing keeps ripping, but, ooh, I put a patella there. There you go. Then I can go ahead and stretch it out, no problem, because one part of it is slack. See? The muscle is relaxed because the other part is relaxed. But if I took this, and let me turn Sam for a second here, and I pulled this, I already know that's going to stretch it out. But then I took Sam's up here, the hip portion, and I don't slack it, and I stretch it even too. Look what happens. It's tight now. And because our muscles are not tear bands, at some point it's going to go to the maximum that it can go. Because it has moved to its insufficiency. Oh, there it is. Or it'll rip. So it is passive because it's not the patient moving it. It's me moving it to where both joints are stretching out that muscle and putting it into a passive insufficiency. That's the concept. The question said, which position will cause the quads to be in a passive insufficiency? Well, I just showed you that. So first of all, the quads that is going to go into passive insufficiency is the rectus femoris. So it's not all four of them. Then if I'm trying to test somebody There goes my muscle. If I'm trying to test somebody's knee flexion, and I'm trying to do a goniometry right here, but I am also stretching this portion, my knee will not bend any further because the antagonist of that motion, so the one that's in front, in this case is the quads, is going to a passive insufficiency. So if I even had more flexion on this knee, if I could flex any more, I won't be able to see it because I'm stretching this muscle into the two joints that it crosses. So if you're thinking, okay, well, then how can I get a true reading of what's happening here in the knee without making the rectus so tight, so insufficient that I can't get it any more flexed, is I need to slack, just like I did in that first motion. I need to slack the rectus, and then guess what? Look at that. I can bend the knee. Therefore, that is how the muscle that is in the front of a joint will affect how you can move that joint based on how many areas does the muscle that's on the opposite side crosses. And if it crosses two areas and I have both areas pulled to its maximum, I have reached an insufficiency. So when you're asked questions in regards to passive insufficiency, you have to think of which muscle are we talking about so that I can then choose to say, if I put this person, so let's talk about position. So if I'm testing this person laying down and I need to get knee flexion, it's going to be best that I don't extend the hip so that I can get a true knee flexion. Whereas if I put him in a prone position, I will be stretching out this end simply because of what the position is. And then when I get to this end, I'm going to get limited because the person is going to feel like that is going to happen. Like the very top end is going to tear. And therefore, that is how a passive insufficiency of a muscle will affect the position of manual muscle testing and goniometry.